Welcome to ScrubNotes, What to Say in Clinical Encounters. Whether you're heading into an OSCE, starting rotations, or just trying to feel less awkward talking to patients, this podcast is here to help you sound more organized, more confident, and more natural with patients without memorizing long scripts. I'm Kate, a medical student, and I break down simple, repeatable frameworks so you know exactly what to say in real clinical situations. Each episode is short, practical, and focused on one specific skill, with examples of what to actually say in real encounters so you can use it right away. All right, let's get into today's skill. Some of the most important questions you'll ask in medicine are also the most uncomfortable. Questions about sexual history, substance use, mental health, and safety at home. And in those moments, a lot of students hesitate and think, how do I ask this without making it weird? So they either avoid the question, rush through it, or sound awkward and unsure. And the challenge is, patients can feel that hesitation. Even if your wording is correct, the delivery matters. So today we'll work on fixing that. Most students know what they're supposed to ask. That's not the issue here. The issue is how to ask it in a way that feels professional, natural, and respectful. So what happens? Well, the question feels abrupt, the patient gets uncomfortable, or you lose confidence mid-sentence. Or you start to overthink it in real time, like I do, and your wording becomes less clear. And sometimes the question doesn't get asked at all, which is where this becomes more than a communication issue, it becomes a clinical issue. This is where the CONNECT framework becomes especially important. In the last episode, we talked about how to introduce a physical exam using clear, structured approach with context, navigate, ease, confirm, and tie it together. That helped you transition into the exam smoothly. Now we're applying that same idea, but to one of the most high-stake parts of the encounter. Because sensitive questions aren't about memorizing the wording, they're about knowing how you set them up. So today, we'll focus on context, ease, confirm. These are the steps that turn an uncomfortable question into a professional, routine part of the encounter. So let's break this into a simple, repeatable structure that you can use in any scenario. Before asking something sensitive, you set the stage. Here's an example soundbite. I'm going to ask a few routine questions that we ask all patients. Or, I ask everyone these questions because they can impact your health. This step is doing a lot of work behind the scenes. Here's why it works. It removes the feeling of being singled out, makes the question feel standard, reduces patient defensiveness, and it shifts the question from, why are you asking me this, to, this is just part of normal care. So this is one of the most powerful steps. Step 2 is ease. We want to reduce discomfort and build safety. So this is where you can soften the transition. Here's some example sound bites. Some of the questions can feel a bit personal. Feel free to share only what you're comfortable with. This is where you give the patient control. This shows respect, gives the patient autonomy, and builds trust. And, interestingly, when patients feel that control, they're often more willing to share, not less. Step 3 is to ask clearly and directly. This is where many people overcompensate. They either talk about the question or make it overly complicated, or they lower their voice, hesitate, and change tone, which can actually make the question feel more uncomfortable. Instead, try to be clear and neutral. Here's some examples. Do you use any tobacco, alcohol, or recreational drugs? Are you currently sexually active? Do you feel safe at home? Notice the tone here. Calm, matter-of-fact, and non-judgmental. Simple, direct, and professional is our goal. Step 4 is where you want to confirm and keep it open. So after asking, give space and keep it non-judgmental. For example, thank you for sharing that. Or, I appreciate you being open about this. Even a short acknowledgement goes a long way. This reinforces psychological safety. And it signals to the patient, this is a safe space to talk about these things. So let's hear what that sounds like when it all flows together. Listen for how the setup makes the question feel routine, not awkward. I'm going to ask a few routine questions that we ask all patients because they can affect overall health. Some of these may feel a bit personal, so feel free to share only what you're comfortable with. Do you use any tobacco, alcohol, or recreational drugs? Thank you for sharing that. So notice no awkwardness, no hesitation, no over-explaining, just context, ease, clear question, confirm. And this entire sentence takes, 15 seconds, but completely changes how the visit feels. Let's review a couple common mistakes so you can avoid them. Number 1 is avoiding the question altogether. This can lead to misdiagnoses and incomplete care. If it feels uncomfortable to ask, it's probably important. Number 2 is over-softening to the point of confusion. So I just want to ask a question if maybe you can tell that makes you sound unsure and the patient picks up on that right away. And mistake number 3 is sounding judgmental, even if unintentionally. Remember, tone matters just as much as wording. Even subtle changes in tone or facial expressions can affect how safe the patient feels responding. So keep it neutral and matter of fact. So if we incorporate this into your OSCE performance, this can be a major differentiator in your OSCE exam. Because when it's done well, it shows professionalism, empathy, patient-centered communication, and it shows you can handle uncomfortable topics without avoiding them or overcompensating. It also demonstrates that you can handle difficult conversations with clarity and respect, which is exactly what the examiners are looking for. If you remember one thing from this episode, I hope it's this: normalize, ease, ask clearly, and acknowledge. You don't need perfect phrasing, you just need a consistent structure. And just like with the previous episodes, this becomes much easier once you practice saying it out loud. In the next episode, we're going to walk through a general OSCE encounter. That's where a lot of students start to lose structure, so we'll practice that in an OSCE framework. As we keep building this out, you'll start to see how the same Connect framework applies to every part of the encounter, as well as to different encounter types. If this episode helped you feel more confident asking sensitive questions, please share it, because that's exactly what this podcast series is designed to help with. That's it for today's episode. Great job showing up and putting in the reps. Whether this felt easy or a little uncomfortable, that's exactly where growth happens. This isn't about memorizing scripts, it's about building a system. If you found this helpful, take a second to follow or share it with a classmate. Let's make clinical communication a little less stressful for everyone. Thanks for listening, and keep practicing. You got this, future doc.